for quite a while. So I'm very proud of our team to really be on the forefront of this type of stakeholder engagement, to really help foster and facilitate some meaningful and collaborative conversation. So I'll go ahead and go to the next slide. Quickly, our mission here is improving healthcare quality, access, and outcomes for the people we serve, while saving Coloradans money on healthcare and driving value for Colorado. Next slide. Quick introductions. My name is Paul Hutchings. I will be your host and facilitator for this meeting today. Quick background on myself. I have my doctorate degree in physical therapy, which I obtained way back in 2007, which now that I say that out loud, seems like a really long time ago. Did outpatient orthopedics for a few years, pediatrics, and then for the last 12 years or so of my career there, I worked specifically in the home health arena. About 2 years ago, I joined the department, and I was specifically hired to oversee some of the ARPA projects that were going on. My main one was the long-term home health and long-term home health and private duty nursing QD tools, which are currently being developed. Back in January, I was offered the opportunity to join the participant-directed programs unit, so I jumped on board with this great team to be a home health policy advisor. With me today, we do have quite a few folks from the department. A few I'd like to point out is my counterparts and one of my absolute best friends, Christine Merriman, who is another home health policy advisor. So Christine, if you want to jump on and say a quick hello.
Hi, everyone. Some of you may know me from other stakeholder engagement opportunities. I'm Christine Merriman. I've been with the department almost 2 years in the policy advisor role. Previous to that, I ran a home health agency in rural Western Colorado for about 15 years. I also have some experience in nursing home administration as well as assisted living. So kind of a well-rounded background, but focusing more on the operations side of skilled home health agencies, and just happy to be on this side, helping agencies help our neighbors.
Yep. And we also have Erin Thatcher on the call as well today.
Good afternoon, everyone. Thank you, Paul. Hi, for those of you who don't know me, I'm Erin Thatcher. I'm the unit supervisor, and I support Paul and Christine and a lot of our great policy advisors here. I just wanted to share that I'm kind of here in a dual role. So I'm here as a parent of children who receive home health services and have for many years. And so as a parent and stakeholder, I feel like it's really important to have these voices here. And then secondarily, I've been at the department for 7 years working on primarily Class B agency work, as well as participant-directed programs, which all of you may not be aware of, but we're not going to touch on today. We're only talking about long-term home health. So thank you so much, Paul. Look forward to meeting with all of you for the next couple months.
Great, thank you guys. And also like to point out, we do have some of our clinical team here from CCQI. So thank you to everyone for being here. We do appreciate your time. We can go ahead and go on to the next slide. Some quick housekeeping. Please note that this meeting is being recorded. We want to make sure that the folks who are unable to attend today's meeting have access to this. Following this meeting, I will try to get this posted by the end of the week to our home health website. I think that link should go up in our chat as well. Thank you, Erin, for doing that. So that, as well as this slide deck we were presenting, will also be on our home health website. If you're not speaking, please mute your phone or computer. If you have a comment, a suggestion, a question, please raise your hand. You can unmute yourself. We are asking, since this is a collaborative work group, that you identify yourself when speaking so we know who we're talking to and get to know you better. Additionally, if you'd like to, you can also use the chat box to put any questions, comments, suggestions. We do have department folks watching the chat box as well as the queue for any questions or anything like that. Also, please do not disclose any protected health information. We are unable to discuss any specific cases during this specific work group. And then finally, we do ask that you are respectful of everyone else in this work group, including those that might have a different opinion than yours. And then quickly for our folks on the phone, you can mute your phone by pushing *6. and unmute by doing the same thing as well. Following this meeting, we will have a feedback form, which will be provided to you via a link. You can put any feedback you have for this meeting, any other ideas, suggestions that you might have that may have escaped you during this work group. We can also provide the link to our home health inbox, which Christine and I monitor daily, so we can get all of your suggestions and ideas as well. And then also, we'll continue to put this up for the folks who are joining us late, but please make sure you are filling out the attendance form as well. We appreciate that. All right, next slide, please. The purpose of this work group. The purpose of this work group is really to include you, our work group participants, our stakeholders. That includes members and family members, advocates, providers, case managers, to openly collaborate with us, our department folks, to help determine an approach to restart this PAR process for the pediatric long-term home health benefits. We want to make this an open, and I think the word we want to use more than anything else is collaboration. We don't want to come here and dictate to you what is going to happen and when and why. We want to hear from you. We want to hear your voices. That's what this work group is about, and we're really proud to bring this to you. These meetings are intended to be educational and really foster a productive environment for everyone that's involved. Any proposed ideas will be discussed, and any feedback from our work group participants will be documented. Next slide, please. The primary goal for this work group is to collaborate with you, our stakeholders, our participants. You guys are a very diverse group of folks, and we want to be very open with you in terms of our operations, any processes that are going through, and communications necessary regarding this PAR restart process, while ensuring that we are maintaining our federal and state regulations as well. Not only are we going to seek to get back any ideas and suggestions of how you guys, our providers, want to get this process started again, but we also want to openly communicate any approaches that we have, any communication strategies, any training needs that you might see fit, as well as any of the notifications that we're going to provide to our members before the PAR pause is lifted in April of 2026. And we'll jump into our timeline a little bit further on in this meeting. Next slide, please. The purpose of the pause. Why do we have PARs? Well, because we have to. We are federally required to do so. Federal regulations require that all state medical agencies include a statewide surveillance and utilization review subsystem. I promise I'm going to try not to read all these slides to you, but this one I had to because it's a lot of words and I could not memorize it. Really what we want to do is ensure that services are medically necessary, and we want to prevent, detect, and control any types of fraud that is going out there. Colorado does this. We meet this federal requirement by requiring services to be pre-approved by prior authorization. In order to do that, we utilize a utilization management system, a vendor, Accenture Health, which used to be called KeyPro. Well, I'm sure many of you guys have heard that as well. So, next slide. Just a quick background here. The operational memo, actually that is, let me see, let me get the actual memo for you here. Sorry about that. Looks like that got cut off. It's operational memo. It's actually 20062. This was published back in June of 2020. Explain why the PAR process initially were paused. The memo itself read that there were issues and concerns with denial notices that were going out for both PDN as well as long-term home health. Because of that, they decided to do administrative approvals through June of 2020, which we all know went further and further and further. And that was really to accommodate the department's work to revise the denial notices and complete any system changes. Next slide. Further background here. Further memo, another operational memo, 21060, came out in 2021, and said that the administrative approval process continued through at least September of 2021, again to accommodate the department's work to revise these denial notices and complete the system changes. This states that they were turned back on in October. As we all know, that changed into November of 2021. And there was a final memo that we found published in our memo series, and we can provide those links if requested. It was an informational memo titled 23044. This was published in November of 2023 and say that HCPF is extending the pause through at least January of 2025. That means that all PARs will not resume before January 31 of 2025 for all pediatric long-term home health services. Next slide, please. And let's do a quick pause right here. I feel like I've been talking a lot. Do we have any questions or concerns or anything else from our work group participants? Yep, Megan, go ahead.
I have a question about the timeline you just posted, but you want questions on what you've covered thus far?
Let's get through the timeline, then you can ask. Then you can
Perfect.
ask a question. How about that?
Sounds good.
Okay. Okay. And let's see. Anything in the queue? Okay, so let's go ahead and talk about this timeline. And Megan, I got you queued up, okay? Originally, the PARs for pediatric long-term home health were paused in July of 2020. The department began a phased-in approach in November 1st of 2021 that only lasted for a few months before we paused them again in February of 2022. So really in this work group, we're going to do two things. Number one is we're going to talk about this proposed soft launch, which will be in the next slide, and we'll kind of get into a little more detail. And then we're also going to talk about ways to phase in the PARs again beginning in April of 2025. So that's going to be kind of the majority and the bulk of this meeting is talking about those two things, and those will be discussed in these next upcoming slides. Yeah. Go ahead, Megan, if
No, you can keep going. If we're going to talk more about timeline, I'll wait.
Yeah, it's all timeline and numbers and dates from here on out. So yeah, feel free to jump in at any time, though. Let's go ahead and go to the next slide, please. All right, so the first thing we're going to talk about in this work group today, and this is a proposed idea from the department. And again, feel free to raise your hand, comment in the chat box, because this is where we need to get as much input from you as well in regards to the soft launch that we've talked about, as well as any ideas for the phased-in approach. One idea that came out was proposing what we call a soft launch, which will begin in October of this year. So for 6 months, so we're looking at October, November, December, January, February, March. This would allow providers a practice, you can even call it a training opportunity, to submit their PARs to Essentra. This really gives providers a 6-month runway or a leeway before we start the actual phased-in approach of April of next year. Essentra would review these PARs, determine medical necessity, and then submit it back to the providers. The fun thing we're talking about, and I say fun because PARs are apparently fun, the medical necessity reviews will not impact the income of the PARs. So technically they're still paused, but we felt this would be a really great opportunity for any providers. If you had any questions, concerns, if you didn't really know how the PAR process is going to work and you wanted to try a few things out, you can submit as many or as little as you'd like to Essentra starting in October, get feedback that you'd like. And then please note that, again, this will not affect the outcome of any type of a PAR situation. So I'm going to open up the floor here a little bit. If any participants would like to jump in, anyone from the department who'd like to talk about this idea, or let's get some ideas rolling if you guys have any.
All right. I can jump in.
Yeah.
I'm always happy to talk in these meetings. Megan Bowser, I'm a parent and also with Family Voices Colorado. I'm at my kids' horse therapy right now, so I was mostly off camera.
We just learned about hippotherapy in our last meeting. Yes.
I know, it's awesome. Horses, it's beautiful. So I guess I'm wondering how this process is going to coincide with CFC and the timing and how those two programs are going to relate to each other. That's not so much applicable or doesn't have much impact on like PTOT speech. The therapy is outpatient, but the CNA PARs, those two things are going to intertwine somewhat dramatically with the expansion of IHSS and CNAs. I think we're going to have a lot of kids who are currently utilizing home health CNA who are going to switch to the IHSS program. So I'm a little concerned about the timeline in terms of it's going to be halfway overlapping CFC launch, but not fully overlapping. So there's like kind of this weird way those two are going to overlap in terms of the timelines we have. And I wonder if there's a way to better coincide those two together or do one and then the other instead of having them half overlap. Because we're going to have kids that are currently receiving CNA who need to switch to IHSS, but that rollout is happening starting July 2025 until July 2026. We might have some who get kicked off of their CNA PAR, but they are not due for their waiver revision to be allowed to be on IHSS quite yet.
No, I love it. Thank you. You bring in a lot of great points there. Erin, did you want to tackle this? I saw you had your hand raised.
Sure. Thank you, Megan. Thank you very much. I will just say we are working on CFC because our other benefits, IHSS and CDOS, will be available in the state plan. And so there's a lot happening there. I think we need to further develop what kind of timelines for both of these approaches would look like. And I think that's one piece we haven't really even considered. And I do think there's going to be overlap in people deciding. And ultimately, we want people to decide in CFC what service options work best for them and to choose whether it's CNA or IHSS and PDN or a mix of all three or what have you. So we can definitely take that back to develop kind of the coinciding timelines for the next time we meet.
Awesome. Yeah, I mean, I guess I see with the reinstatement of the PAR on the CNA end of things, we're going to have some that get approved, hopefully as many as possible that should get approved right away. We're going to have some that get denied because there's problems with the PAR process. Somebody doesn't submit it well. Centra denies it wrong, like the same issues we saw before. But then we're going to also have this population that have been receiving CNA that probably should not have been receiving CNA. They don't actually fit in that box all that well, but they will fit in the personal care box under IHSS or CDOS really well. And so as much as we can avoid having people who get kicked off of CNA lose their entire family's income and ability to house and feed themselves while they're in this gap between having access to those services would be amazing.
Yeah, thank you, Megan, for bringing that up. That is a wonderful point, and we will take that back. I think Jennifer Cooper, if you'd like to go ahead.
Hi. Yeah, hi, I'm Jen. I'm one of the nurses with MJ Home Care. And can you guys hear me okay? I just want to make sure that first.
Yeah, we sure can.
So I just wanted to make sure, so obviously there's multiple projects going on at the same time with revising the long-term home health tool for adults, and then also revising the long-term home health rule, just in general. I guess my questions are, is there going to be any revisions to the pediatric home health tool? And then like, is there going to be overlap with starting the soft launch with trying to rewrite the long-term home health rule as well?
Yeah, that's a great question. You're right. We are having another work group, and that was going to be my plug at the end of this to get you guys all to come to that one as well. We are looking at rewriting some of the rules for long-term home health, and that's the other work group that will be effective. We're going to start that on May 22nd. So we'll do a quick plug for that at the end. Looking at that rules and looking at the different specifications for that. That will be a multi-month process, so that will be coming into that. It will roll into the same time. There will be some overlap into this soft launch. I hopefully won't play too much of a deal going into the two of those. I don't know if anyone else in the department can speak to that overlap. But I don't foresee the rule revision playing too much of a part into the soft launch aspect of things. And then in terms of the tool that's being developed by UMass, it's actually a series of tools. It's the that they are working on. That is set to come out. They should have that done in September of this year as well. But that'll also be, we will not be implementing that right away either. There'll be a lot of training that goes on with that. Thank you, Aaron, for putting that in. Again, if I don't know if anyone else in the department wants to speak to that, but during the soft launch period for that 6 months, again, that's kind of an open invitation to get these worked out and make sure that we don't have any conflicting issues.
Great. And then just one more question. With the soft launch, is there any expectation on like a minimum or maximum number of like cases that agencies are submitting for the medical necessity reviews?
No, there's not. Again, and this, I want to really emphasize, like, this is as much meeting as it is, ours. We want to hear from you guys. If you guys want to do 10 per month, if you want to do 20, what do you guys think is feasible? I mean, you guys are the providers. You guys are the ones having to submit this. I mean, do you even think this is a good idea? And I see you've got your hand raised too, Kobe. What do you think is good? Do you think there should be a minimum? Do you think there should be a maximum? I mean, what, from the provider point of view or perspective, what do you guys think is reasonable?
I would say that it's going to vary based off of the agencies and our, clientele, obviously, like our census. But I do think that having the overlap is going to be a little bit tough because initially, as we're submitting things, if it affects what like that medical necessity looks like down the road, it might make a little bit more sense to wait on the soft launch. I like the idea of the soft launch just so that we can see how things are going to come back for our patients and see, like, basically if there are going to be kiddos that are going to potentially lose services, we can start preparing those families for the loss of the services and start like game planning other services that they could get, on the front end and just get in front of all of that. I do love the idea of the soft launch though. And I would say that as our agency, we probably would start submitting the ones that we're not sure are going to get approved, would probably be like the highest priority for us.
Let me ask you this. Do you think we should have a minimum for all providers? Like minimums, like providers should have to submit something, or do you think it should be up to the providers to if they want to or not? Because I guess my concern is, again, I don't want to get into next year, into April, where we start doing a phase-in approach, again, which we'll talk about in a little bit, and then have some providers like, oh, well, we didn't know about this, and we were unprepared, versus telling everyone, hey, you do have to do a minimum of at least 5 a month or whatever. I don't know. It's different from you guys as a provider. Do you think we should enforce it? Do you think it should be voluntary? And this is open to anyone. I'm not picking on you, Jen.
No worries.
So just food for thought. And you guys can, okay, so we have some voluntary. Cool.
And just a note, Paul, this is Erin. We've got Colby and then also Chris Russell in the queue.
Okay. Colby, go ahead. I think I called you Kobe before, so I will.
Hey, that's all right. It was close. So I just had a couple of questions. I mean, I definitely see the point of it being voluntary with the provider community, right? Just because it's going to be dependent on, bandwidth and other things that they can do. I would say that there could be benefits of having a minimum requirement simply to ensure that the member community is aware of everything as well. And if, say that one agency decides to, partake in this and they want to submit all of their portions in this soft launch and another one doesn't, we could see some patients moving in between providers just in the sense of not wanting to or willing to participate in, a soft launch process. So just something to consider on that side. And then I guess my other question with the soft launch, I know that, the medical necessity part would be reviewed. What would be the intended kind of purpose, I guess, as far as, yes, we would be able to identify, members that potentially wouldn't qualify or, do qualify or whatever that may be, but will Essentra get feedback? Will the department get feedback during the time? Like, I guess what would be the main takeaway for a soft launch as opposed to just getting providers back in the rhythm of submitting those pediatric PARs?
Sure, that's a great question. And you're with Team Select, right?
Yes. Yep. Sorry.
Okay. Let me make sure everyone knows who you were with. Yeah, and Cassie, I don't know if you can speak a little bit more to the soft launch and the purpose of it. The idea is just to give. It's been a long time. Okay, it's been almost 4 years since we've done a full launch of PARs. Some places are doing it, some places are not. And the idea is for providers to submit, get medical necessity back, and then have a really good idea of exactly what they're looking at. So they're not getting just completely, awestruck once April comes up. So it's just an idea for them. It's just more feedback. It's a training. It's a practice run for anything like that. So I don't know if Cassie, I don't know if you have any other anything to add to that for the soft launch aspect.
Sure, I could hop in. Excuse me. So I think you hit it right there, Colby, is that we want this to be a training opportunity for all parties involved. So the provider would be submitting that PAR request for medical necessity. The provider would be getting back information about this is what's missing, this is what needs more documentation, this is where we're seeing a lack of information, whatnot. So there would be a feedback loop to that provider that says, this is what's needed, this is what's not needed, all of that. The URUM vendor would have that feedback as well. We'd be providing training and technical assistance and guidance to them as they're resuming these PARs. So it's really, we're hoping it would be beneficial for everybody involved.
Cool. That makes sense. The last thing I was going to just say on this, it's not really from a timeline perspective or, anything like that, but just something I think to consider for the group is it would be nice if the prior authorizations were truly that, as far as prior authorizations for service, as opposed to requiring some of the documents that we need after we've completed a start of care on a patient to know if they're going to qualify for services or not. So I know that's a bigger conversation to kind of go through, but I just wanted to say it more publicly that that would be a helpful, I think, process to maybe try to get to as we go through this over the next couple of years.
Great, thanks for that.
Okay, Paul, in the queue, we've got Chris Russell and then Kristen and then Megan again.
Okay, Chris Russell, if you want to go ahead.
Yes, I'm the family advocate at Aviana Healthcare. I know that this is, my answer here is based on me having pretty severe PTSD over what's happened over the last year. It seems to me, when I look at our population of people who are getting CNA parent services, that you're going to have a drastic reduction in CNA PARs in the big picture. And it seems like going through all of this should wait until after CFC is up and rolling so that you've already cleared out everybody who was going to be a CNA but is actually not going to be a CNA in the big picture. I mean, do we know that the CCM is going to be working by then? Do we know that all these problems are going to be muted, at least, if not fixed? I'm so afraid of something else being launched when all of these problems still exist, monstrously exist, affecting families in profound ways. And it seems like this overlap of the CFC launch and rollout and the CNA PAR, it seems like they're close enough that it makes sense to me to first reduce all the people that are currently CNAs that are not going to be CNAs anymore. And I'm just guessing that it's a huge amount. And then you would have this small amount of people still doing CNA, and it wouldn't be the mess that this is potentially going to create. If nothing else, the amount of appeals that the court is going to have to be dealing with here seems to me to be humongous. And I don't know, if it was my choice, I would wait until the thing that's going to put people in their right place is completed and then see what's left to deal with here. That would be my take on this. Thanks so much, guys.
Great. Thank you, Chris. We appreciate that. And we acknowledge that there is a lot going on. And, you know, that's one of the big reasons we are trying to really promote this soft launch idea, is to at least get it out there and make sure that people are seeing what is going on and give people a 6-month runway before we do this. But yeah, thank you. You're right, Holly. That was a great point. We really appreciate it, Chris. Aaron, did you want to speak to CFC at all?
Thank you, Paul. I'll just say, Chris, thank you. You said a lot of things that I think resonate with the community, at least on the family side of things, and appreciate your work in that realm. We can definitely take this and evaluate what is feasible. And I'll just say this, like, I think, you know, the option of CFC is going to be so huge for so many people. And I'm excited because it brings participant direction to the masses. But, you know, we want to avoid unintended consequences. And I'll also add, like, we've paused resuming PARs because we want to get it right. So we're having discussions now. We're working on what it's going to look like. And this feedback is exactly what we need. So thank you. So Kristen is up next, Paul.
Kristen, go ahead. Thank you.
Hi, I'm Kristen Waldrop with Nursing and Therapy Services. So I have a question. Can we somehow receive training or identification in regards to what the medical necessity parameters are going to be determined by Accentra? Because in the past, we have had very hard time figuring out exactly what qualifications they specifically are looking for. And I think a training or understanding what they're deeming as medical necessity would be beneficial, not to mention so we can also make our arguments for the medical necessity qualifications.
Yeah, I think that's a great idea, to provide training to providers, and then in addition to being able to submit to Accentra and getting that medical necessity back as well. So I think it's kind of a twofold thing. But yeah, I think that's a wonderful idea that I've written down here. So thank you for that.
Okay, up next is Megan.
Yeah, I thought, Megan, is your hand still up?
Yeah, I mean, I echo everything Chris Russell said. Yes, ditto. On the soft launch topic, though, I'm wondering if there's a way to incentivize it for providers to make it worth their while to do the soft launch. Like, if you get an approval of a PAR during the soft launch, then you have longer, you get to be at the very end of that time period, or that there's some way to reward that work that they're doing to participate in the soft launch that would alleviate work for them down the road, and would help you guys too to have those PARs going through. Because the more PAR requests that go through in the soft launch, the better the department's going to be able to see that as well. So I'm wondering if there's just some ways to incentivize it so we don't have to mandate it, but it will be more utilized.
Yeah, I love that idea. That's one of the things we had talked about before, was how do we incentivize providers to do this? Because you're taking more time out of your own day to do this. So we thought about, yes, it provides training. Yes, you get feedback. But for doing that, I think that's a really great idea. I would love to see if we can take that back to the group and see if we can make that work of further incentivizing them by taking those PARs that made through and again, pushing them back to the end. So great idea. Thank you. Do we have any other hands that were raised?
Paul, I'm not seeing anybody. I'll mention, if you're on the phone and you'd like to chime in, you might need to just pop out and say hi, so we can hear you. Unmuting your line is probably the easiest way. So any other questions before we move on? Or comments or thoughts? Okay, Chris, go ahead.
Sorry, Aaron. I just was thinking that it might be a very useful thing for agencies to have some kind of a directional map, whatever that you want to call it, that explains how the new CFC opportunities would mesh with CNA, so that could be thought through I'm just trying to avoid all of this work, which none of us have any time for because we are so overwhelmed by what's happening. But if we could minimize that and not use our energies in things that aren't going to be useful in the very near future, that would be very helpful, I think. And I don't know if something could be put together that indicated where you could go instead of CNA services, what direction you could go in. Thank you.
Great. Thank you, Chris. I love these ideas. Thank you, guys. I mean, again, we're trying to make this as a collaborative approach as possible. Yeah, Aaron, go ahead.
So thank you, Paul. One question for the group. Right now, so the PARs are paused for pediatric long-term home health, which includes our in-home therapy, so PT, OT, speech language pathology, and CNA. And intermittent nursing. So all those pediatric services. Do we think that there would be a variance for different types of providers? Because I think it seems like, and I'll just speak for myself, like I'm thinking about therapy in a different way than I'm thinking about CNA. And so if we were to do a soft launch, would that be for all of the providers who are currently on pause for PAR, or would there be a separate practice depending on what type of service?
Yeah, Megan, go ahead.
I guess I think it would be brilliant to do the soft launch, the timeline that you've proposed here, to do that timeline for therapies and intermittent nursing, following that timeline, and then just take CNA as a separate piece and do a mirrored timeline later on for that after CFC is fully implemented.
Yep, Jennifer, go ahead.
Yeah, I agree. I think that like as an agency, we provide all three long-term home health services. And so if we were to try to do all of them at the same time, I can see with all of the agencies, it would potentially be overwhelming to Centra as well. So I think maybe some type of like phase launch with the soft launch might be helpful for all of the long-term home health services, would potentially be helpful.
Yep, I can see that. Thank you guys for the ideas and the contributions. This is great. So I think looking from what I can gather, the soft launch seems like a good idea. I think most people are looking, let's make this voluntary with some incentivizing methods or some incentivizing practices for our providers. So we just got to figure out what that is and how we can implement that. And then maybe doing a phased in soft launch where we have therapy and nursing on one side and then kind of mirroring that same part for CNAs as well. So we will take these ideas, and then when we meet again, we'll hopefully have a few more concrete ideas to run past you guys. Before we move into the phased in approach and how we want to tackle that, does anyone have anything else to say or contribute to the soft launch idea? Okay, that sounds great. Go ahead and go to the next slide, please. So this is looking at now for the phased in approach that we are projecting that or proposing that we'd like to do on starting April 1st, 2025. Prior to this, when we launched it back in November of 2021, it was done by percentages. So it was a 10-month phased in process. So 10% of all PARs would be provided per month for 10 months. Again, that did not last long due to various reasons, including the denial notices, which we talked about previously. So what we'd like to do now, instead of just dropping this on providers and saying we will do another percentage per month, again, open this up to the floor and see what other ideas you have. We put a few up here just to kind of get some talking points. These are certainly not anything that we have any concrete ideas or decisions about, but just enough to, again, to get some conversation going and see what else you guys have to offer, or see what else other ideas you guys might have as providers and members and family members. Oh, I think you guys raised your hand at the exact same time.
Colby can go first.
All right, Colby, you win. Alphabetical.
Yeah, I'll make it quick. I was just going to say, I did feel like as far as just from an organizational standpoint and having the most accurate and up-to-date information, the certification dates I felt like was appropriate from like a provider perspective. I think each one has a positive and negative, but I felt like that was a simple process to follow and a little bit less burdensome overall for the providers.
Okay, thank you. Aaron, go ahead.
Thank you. So putting my parent hat on right now, I think between all of the different therapies and agencies and waivers, I think we have like, I don't know, 8 different like certification spans. So like for me, I would say, like, again, family perspective here, anything that can really align services so they're being evaluated at the same time would be really helpful, because there's a lot going on. And I think especially if we're looking at what kind of documentation might be needed by the family, or like, yeah, I don't know. Again, we haven't done PARs in a long time, but I would say something that could be used across all types of long-term home health services. And if it could align with waiver, that would be cool too. But I'm not sure how we really do that. I think the certification dates thing gets a little dicey, especially when you have maybe multiple agencies and in-house, like all doing services. Okay, parent hat off. I'm going back to Hickory.
Thank you. Thank you, Ms. Thatcher. I've seen a couple comments about percentages. So we got that. Jen, go ahead.
I just wanted to clarify. So the phase-in approach is going to start April 1st of 2025, and then the full implementation is supposed to be by April 2026. So basically, we're going to have a year to get all of our PARs submitted. Is basically what the plan is.
Correct. Yes.
Okay.
We're trying to get this. I mean, we're starting right now, and we're basically looking us collaboratively, us as the work group, figure out what we need to do in the next 2 years. So whether or not that's going to be, again, half at soft launch, half at phase in, and if we want to do this phase in, how do we go about it? How do we present this to providers in a way that's coming from all of us and not just the departments? So, Chris, yeah, go ahead, please.
I'm just wondering if people are going to wait till the very last part of when the CNA PARs can be sent so that the CFC is almost done so that they can avoid all of this. Just thinking there, it's like, what, like 3 months difference at the end there. I don't know. I'm wondering if you're going to get a lot of PAR requests at the very end so that people can have moved to CFC if they desire to do that.
Yeah, it's a good point. Thank you for bringing that up. We hope not. Hopefully there are a lot of other services to look at as well, other than CNAs, but hopefully that providers don't just wait to the very end. We definitely don't want to do that. Yes, Cassie.
Yeah, thanks, Paul. I think we absolutely did see that occur with private duty nursing. And so I think that's one of the things that we'd like to try and avoid this time around. And, we're struggling a bit with how do we do that? We can provide training. We can highly encourage it. We can beg and plead and send you 100 emails throughout the year asking for you to make those submissions. But other than that, are there some other things? Should we implement some kind of penalty if you don't submit claims by a certain time? Should we withhold claims and payment on that? Because I think what we don't want to see is nothing gets submitted, and then boom, here's 1,000 cases from a particular provider agency. So we'd love some thoughts on that and some ways to mitigate having that occur. And how would folks feel if we tried to put a suspension on claims?
Thanks, Cassie. Any ideas, thoughts on?
I can see everyone loved my idea about suspension of claims. I have stunned you into silence.
I think it's what's called an awkward pause, actually. Yeah.
Okay, Paul, I think we have Kristen.
Yeah, Kristen, go ahead.
I would highly discourage against causing claims because I think that would cause undue harm to the clients and the families. If you're trying to, quote unquote, teach the provider a lesson, doing that to the family would not be beneficial. It would just cause more problems.
Let me ask you this. How do we get away from providers then, and this is again all hypothetical, submitting all their claims, all their PARs all at once then? Like how do we keep agencies in check? How do we make sure they're actually doing this? I guess I hate holding services, but I mean, at the same time, what do we do with the agencies who are not following the rules, in other words? Because that just will back up the PARs, will back up the authorization process for other companies that are doing it correctly.
But
Again,
you
I'm
need
just spitballing, like, what other ideas do we have?
I would suggest finding a penalty that does not affect the families themselves. I don't know what that would look like. Maybe, I don't know, a CDPHE audit, but not specifically against a singular family. I think that's cruel.
And let me just interject. We're not intending to, withhold services for families. That's not what we're talking about here. What we're talking about is if we have to turn on the PARs by April 1st of 2026, how do we ensure compliance? And going back, like looking at how private duty nursing PAR turn on went, we had some barriers and some roadblocks. And like one of them was we had providers who needed a ton of training. And so we saw denials because the provider didn't know what they needed to submit. And so once we did a lot of targeted training, we saw really improved outcomes, but we don't want to get to the very end. So is there a way we can like phase it in based on some kind of criteria? Like I'm not sure, but sorry, Paul, go ahead. And we've got a couple other people in the queue after Kristen.
Yeah. Chris, I think you're next. Go ahead.
Well, I'm going to jump out here and get in trouble perhaps. I will say that hearing anybody say something about punishing agencies after what we've been through, after how many families have completely lost their ability to make a living because of how long it takes to do a disability determination. There have been so many things that have crushed us over the last year that I don't know. I'm still not over the idea that it was families' responsibilities that they didn't get their renewal packets in. The blaming of our side of things or the family side of things is I don't know, just making me a little crazy here, starting to shake in the core. You guys need to think about the big picture, because this is what is so great about what you're doing right here with this meeting. The providers never get asked how something's going to work. And lots of times we know that there's going to be big trouble because we live this all the time. I really appreciate that you're asking us these questions, but please don't talk about punishing the agencies more. Pretty much a lot of us are about ready to go out of business anyway. It's just, this has been a disaster. And so talking about punishment is not setting right with me. Thanks for listening.
Sure. So let's get rid of the word punishment, because I don't think that's where we want to go. How do we hold providers accountable for what they need to be doing? I guess that's what we need to, and that's one part of this conversation. The other part of this conversation is, again, looking at this work group and asking you guys, the providers, what is the best way to phase things in? Because that's what really this point of the conversation is about, is how do we phase in? We can talk about holding people accountable at a different time, but let's kind of get back on focus here about how do we phase things in. And again, we've heard about certification dates, we've heard about percentages. Do we have any ideas other than about that?
Paul, if I may just and I see there are a slew of hands raised, so I apologize for jumping in the queue. I just want to be clear that all of the providers that are on this call today, they are the ones who are submitting appropriate and complete packets for review. They are the ones who are following the regulations. That you all are the ones that we don't have any concern about. You are not the ones, if you provided private duty nursing, that waited till the very last second. So I don't think we have any intention of trying to punish families, punish providers. What we are really looking at, and I apologize for bringing up suspension of claims, but what kind of options do we have to help bring you all, you great providers, and then those other providers who maybe are not always doing what they are supposed to, don't know what they are supposed to. They're not attending the meetings. They're not reading the provider bulletins and the newsletters and attending our office hours and doing all of those things. So they're not aware. So I think what we are trying to figure out is, in addition to all of what we're doing with information sharing and training and a soft launch, how can we bring all of those providers into the fold and get them to be in compliance? And if it is after 9 months of not turning something in, after us hounding them, then perhaps there is a suspension of claims or some other type of incentive that we can provide. So that's kind of what we're thinking, but by no means do I think anyone on this call is going to fall into this category, because you all are the ones, providers are the ones who are really have bought into this and are working to make the system better.
Okay, Paul, in the queue, let's start with Jennifer.
Thanks. This is Jennifer Cox with All for Kids Home Health. I am definitely on the incentive train, and I had 2 thoughts that we could bounce around. Let's talk about a reason why, if during the soft launch period, if we submit and get a PAR approved, why that can't be approved for real. You know, we do all this work, we come back with all the paperwork you asked for, we spend a lot of time getting this approved. Why can we not have that be fully approved? And if it gets denied, then we know, okay, here's our feedback, here's what we can be working on to improve and for future submissions. But rewarding us for taking the risk to submit something and then getting it approved and not having to redo that work 6 months later. And then on second thought was, suggesting a minimum percent submission during the soft launch without penalty if you don't reach it, whether it's 5% or 10%. Having a suggested, like, please every agency submit at least 5%, at least 10%, whatever it may be. A suggested percentage seems reasonable to me. Thanks so much.
Thanks, Jennifer. I love that idea. Again, we're looking at incentivizing and rewarding. So if you do that, I think it's a really good idea, and I think that's absolutely possible. I will take that back to the team. But thank you very much for bringing that idea up. And then the percentage thing as well. So a suggested percentage. But again, if you guys are, like you said, if you're taking that risk, if you're putting the effort, you should be rewarded, or you should be, at least your PAR should be going through for doing that. So thank you. Megan, go ahead. Yes.
Yeah, I think same thing as what Jennifer said. I was going to say, instead of punishing, I know we're not using the word punish, but instead of effectively punishing, how do we incentivize? How do we use the positive motivation? And I think as we're talking about that, recognizing that the scarcest quantity we have, the thing that is most precious to pretty much every agency at this point, is time and workload. So if there's ways that we can reward them doing extra work by giving them less work that needs to be done later, whether that's now this PAR is approved for 2 years instead of 1 year, or however we can incentivize that to save work later on to reward doing the work up front, I think will make a huge difference with both these agencies that are on it and advocates and the agencies that are not so much.
Great. Thank you, Megan. I agree. Jennifer, go ahead.
I'm just going to beat the dead horse and echo Jennifer and Megan. I think incentivizing, us turning in the PAR. So if we can get authorization for during the soft launch, that would be fantastic. And then just for like it probably would be best to do like a 10% minimum every month, just in, again, with no penalties if we don't meet that 10%, knowing that we have a year to get all the authorizations in, and then that way the agencies have, that last 2 months of the year to get whatever else they haven't gotten submitted. And then again, just whatever incentive HCPF could do for agencies for meeting like not submitting 100, 1,000 in the last 2 months of this implementation.
Yeah, so I guess that brings an idea to me. So I like the idea of the soft launch, and we've like incentivizing and rewarding that. So I think it's a great idea, and I think it's very possible to do that. In terms of the percentage, and again, this is me being ignorant, and I apologize in advance. If we did, let's say we want agencies to submit 10%, who's going to track that? I mean, is it up to the department to track the 10%? Is it up to an agency to then do more work and say, hey, this is 10%? How is that communicated? Anyways, that's just something to throw out there. Go ahead, Chris. Sorry, I didn't mean to cut you out.
You didn't cut me off. I just had one more thing. The reason that I was indicating that people might wait to the very last minute is not because they're recalcitrant. It's because they're trying to juggle the CFC with this, and that is going to be a problem because they're happening at the exact same time with types of services that are what is replaceable by the other in certain ways. And so it's not like somebody's trying to get away with something. It's that we probably don't have the staff to do twice as many PARs. And we don't know what's going to be going wrong. We don't know whether CCM is going to be working. There's so many pieces that are new about this. And everybody thought that everything was going to go okay, and everything just fell apart totally. So just keep in mind how many new things you're talking about here. And then remember this last year, and you'll see why people might wait so that they don't have to duplicate efforts. Just what I'm thinking. Thanks.
All right. Thanks, Chris. And we appreciate your perspective on that as well. Erin, go ahead.
Thank you, Paul. Okay, so I'm thinking about the suggestion from earlier on like the soft launch where we started with therapies and intermittent nursing and then CNA later. What if we flipped that to say CNA first, like, starting in October, you could submit PARs. Those CNA PARs could be, if approved, could be approved until CFC. Is that I think I'll just say, like, thinking October is far away. It's not. October is very soon. Does that scare you as agencies and advocates and members? Like, is that something that might be feasible?
Jen, go ahead.
I actually like the idea of starting with CNA PARs because, again, if we have any kids that we're concerned about, then we can start game planning and have as much time to start game planning any changes to what they need for services. The other thing, I was just going to ask a clarification question in terms of bringing new clients on. Is that going to be considered part of this, or should we be trying, are the agencies going to need to submit prior authorizations for any new clients that they're starting on top of this as well?
Erin, do you want to go ahead and tackle that one?
Yeah. So
I do not know. I'm going to gracefully pass that one on to you.
Yeah, no worries. So we would be considering new clients, like totally new to CNA or therapies, as well as any current members who are technically on pause. So I think it would be all. Does that answer your question?
Yeah, I think before when we did this last time, basically maybe we wouldn't have submitted a new family at the same time. So I think we probably would want to go ahead and submit new families. That way we're not having to track those as not having a PAR once everything's fully implemented.
Okay. And then Megan, I believe you're up next.
Thanks, and I have to jump to another meeting here in a minute, but I get your idea of doing the CNA first. I don't like it though. I think when we think about those families that have been in the CNA, that have been doing CNA, even though that's not really the box they fit best in, but that's the only box that's available right now. If we make them do the PARs right now, those are PARs that if we waited until after CNA or after CFC, those are PARs that don't even need to be submitted. They're going to go away entirely. So if we wait and do those later, then we're going to have less PARs that need to be done. Rather than if we start with those, we're going to have a lot more PARs that need to be done because we won't have had the opportunity to move people to the more appropriate program.
Thanks, Megan. And just so you know, if you guys are putting comments in the chat, we are collecting all of those as well. So we are not ignoring them. So thank you for putting those in there. And I've got Jen, go ahead.
Sorry, I talk a lot on these types of things. So I just wanted to, I guess, maybe put out there that if we did visits and therapy first and then did CNA later, I would suggest maybe keeping the soft launch for CNA authorizations for that same window of time that we would do for skilled nursing and therapy. Because I'm just thinking if we wait to do the CNA until later, I wouldn't want to have a smaller window to work through those ones.
Sure, that is noted, and I agree with you as well on that. And it's Kristen. I can't remember. I should write this down. I just see the K. Is it Kristen?
Yes, sir.
Okay, I'm gonna write that down now. Okay, go ahead.
So I have a question. Do you guys have any correlation to go with the case management assessment, the new push out of that as well? Because there is a new assessment tool also coming out for Medicaid waivers.
Correct. Is anyone in the department that handled that one? I don't know the answer to that.
I can take this one, Paul. So,
Thanks, Sarah.
you know, I think just acknowledging, again, there's a lot going on. There's a lot of new things. So this care and case management tool that Chris referenced, so the CCM, and then there's the assessment, this for waiver participants. So I think one thing that we need to do for the future meeting is to look at what these timelines are looking like right now and kind of put them all in one place to say, here's where, you know, our suggestions for PAR turn on would kind of fall. As it relates to these services though, and I'm going to talk not about like the therapies, but I think, Paul, it might be helpful to talk about the acuity tool and like the intended use and the intended population of the acuity tool process and project that we're working on, just because that does relate to this a bit.
Sure. So without getting into too deep in the woods, we have about 10 minutes left on this meeting before we're going to go into next steps and feedback. So just so we do a quick time check there. In terms of the acuity tool, it is acuity tools. We are working with the University of Massachusetts to produce these tools. And really what it's going to do is give us a very objective number of hours that will be approved. So that tool, these tools should be ready to go by the end of September. And then we're doing a bunch of training with providers through the fall and into the winter. So we still need to figure out when we will implement the tool into the actual the system, but there will be some training going on to that as well. But again, we're looking at figuring out the tool to get an objective answer for the number of hours that will be put out. So again, that's very high level, and the tools can be a whole nother meeting unto itself and how deep it is. I'm sure some of you might have actually already been using some of the prototypes that are going out currently. So Jennifer, go ahead.
I just was going to take one step back to kind of piggyback off of what Chris has been saying today. It doesn't make sense for us to submit a CNA PAR when we anticipate that family and child would be better served in IHSS. And once CFC is finalized, then we would hopefully transition into that service. So I think the recommended or a suggested percentage of submissions of 10% within the 6-month soft launch allows us to make the decisions of like, I know that this family would be better served elsewhere. I'm not going to spend my time submitting a CNA PAR. And without punishing us for not reaching a certain threshold, that's like, I don't want, to have this certain threshold if I feel like a lot of families are going to be moving over. And then additionally, just speaking of the timeline overlap, is this, what did you have? March, I guess, October to March for the soft launch?
October 1 through March 31st.
Okay, so then April 1st.
Correct, yes.
Is there any leeway for that? Like, can we push that to July or August so that allows us to offload families to CFC?
Yeah, I mean, I think, again, this is, a lot of these dates are, they're proposed. They're proposed dates. The main reason April 1st is coming up is due to a lot of the ARPA funds ending around that same time. But again, these are all great ideas and proposals and suggestions that we need to take back. What I'd like to do is after this meeting, I'm going to write up a recap of a lot of the thoughts and ideas. And then if you guys are okay with it, I'm assuming everyone wants to, is regroup at this meeting and come at it and look at these high level ideas, but also look at a different timeline, different things, and see if we can move things. And then also taking a look at the kind of the incentivizing ideas and focus a little bit more on that as well. Yeah, but I think a secondary, maybe even a tertiary meeting to go through with this and looking at the different timelines with the CCM and CFC it would be a valuable use of our time.
Thanks. I just wanted to summarize my suggestion then. If it sounds like the tool would be live the end of 24, the new tools, then having a soft launch the beginning of 25, and then having a hard launch once CFC is live after we've been able to make that transition and give some breathing room for both would be what would be great in my mind. Thank you.
Yep, thank you. Okay, in these last, I don't think there's any other hands up, are there? Okay. These last few minutes before we get to the next steps, does anyone have any other ideas specifically about the phased-in approach? And again, these are proposed dates, proposed timelines, just how we, if anyone has any ideas about how we could implement this. It sounds like percentages is maybe a 5 to 10%. Looking at the department kind of trusting providers and maybe doing a random check kind of throughout the next year to make sure that's being done. Are there any other ideas or suggestions about how someone else would recommend doing a phased-in approach? And again, if you guys think about this or if you guys have any suggestions, at the end here, we will have a feedback form that you can utilize, or again, you can email us at the home health inbox and we will take all of those suggestions as well. Go ahead, Holly.
Hi, it's Holly with All for Kids Home Health. And I just wanted to piggyback on what Jennifer had just said. And I think that maybe it's not enough to just say that when CFC is live. I think it needs to be when CFC is live and functioning well. I have a little bit of pause just because of the case management issues that we've been experiencing so far. And I'm worried that there's going to be so many denials and backlogs, and I mean, they're not handling the caseload that they have right now, and we're potentially increasing that. I mean, I don't even know how many fold. So I just think that it really needs to be functional before we really start moving into this PAR stuff for CNA, OT, PT, speech. Thank you.
Great. Thanks, Holly. All right, anything else from the group? Let's go ahead and move to the next slide then, please. So what's next? We'd like to identify the need for additional meetings, and I think that is a great idea. Hopefully everyone on here is on board. I will go back and touch base with Christine, and I will, again, when I send out the recap email, I'll also send out some proposed dates to see if that works for people. Hopefully the feedback form we've been using with the Google Forms has been working well for folks. And this is to see if that a specific date and a specific time will work. And again, I think if we focus the second meeting more on looking at different timelines and how it's going to play with the CCM and CFC, as well as ideas for incentivizing during a soft launch period, assuming we want to do that, it can kind of be the focus of that secondary meeting. Again, we will post this meeting here, as well as a slide deck on our home health websites. You can also find out the FAQs that are there as well. And then, Aaron, if you don't mind putting in the feedback form for additional ideas, that email gets kicked directly to me, so I will be able to follow those as well.
Paul, that link is in the chat as of 2:02 p.m.
Perfect. Now, there it is. Thank you so much. Okay, next slide, please. So there's the home health inbox again, one more time. So real quick, before we wrap this up, I guess just open this up one more time to folks. I know we've heard some concerns, we've heard some great ideas, seeing a lot of thumbs up. I guess this is just more for everyone. You can put it in the chat, you can give an emoji. Do you think these groups, these work groups are worth your guys' time? Because the last thing we want to do is time is valuable and we want to make sure that everyone is, okay, this is great, thanks. We want to make sure this is valuable to you. And we want to really make sure, again, this is a collaborative group effort for everyone. We want to hear your ideas. We want to hear your proposals. I think the last thing providers want, and again, me being on that side of things at one point, is just getting more dates, more notices of things that are coming and without a reason why. So if we can kind of really do a deep dive into why we're doing this, and I think that will go better, not only with you guys as providers and members, but also the other providers who are unable to make these meetings. So again, I appreciate your time. I appreciate your effort. I appreciate all of your suggestions and your concerns and your worries. We will take all that back. Yeah, Chris, go ahead.
I'm just wondering if it might be useful to invite somebody to represent case management to get their input as to how this would all work, since they will be involved in all of the CFC issues. Once again, I think the more people who are actually affected that could be brainstorming, the better. Thank you so much.
That's great. I got it written down.
And Paul, I think we definitely had some case managers express interest, and that is something, Chris, I will say, we want to make sure we've got representation from everybody, if at all possible. If it touches you, we want someone sharing. And so on that note, I would echo, I know it's like really hard when you've got like young kiddos and school and care and all of that going on, but if there are other families or other folks who might want to contribute as, you know, a participant or provide feedback, they can definitely do that in the form. And we will make sure to reach out to case management again to ensure they can come to this, because that is a huge piece of it. Thanks.
Yeah, go ahead, Chris.
Sorry, guys. I just thought maybe you could put an announcement in the next Children's Disability Advisory Committee to attract parents to this meeting.
Yeah, that's a great idea. We want to make sure it is a work group, and everyone's voices are heard here. I want to make sure that the word is getting out and everyone is available to come. So yes, thanks for that suggestion. Okay. Well, thank you guys all for coming. Again, we appreciate it. We will get this stuff posted to the website and then be on the lookout probably early next week from an email from me, just kind of recapping everything and then getting a few other dates on the docket, and we can do this again. So if that's it, thank you guys so much, and we will see you next time.
Great. Thank you, everybody. Have a good week.